Namaste friends, I am Dr. Devi Prasad Acharya, Consultant and Head Department of Transfusion Medicine Blood Bank, AMRI Hospital Bhubaneswar. AMRI Hospital Blood Bank is one of the leading blood banks in Bhubaneswar as well as Odisha. As a blood bank, we are providing 100% component facility from the blood that are collected from donors, and we provide packed red cells, that is PRC, RDP, that is random donor platelets, FFP, that is fresh frozen plasma, and cryo-precipitates. Along this service, we also provide single donor plasma platelet facility in which platelets are collected from the donors through a cell separator, and the blood is returned to the donors, hence increasing the safety of the donors and as well as the quality of the platelet collected. Now we will discuss about the individual components that we provide in our hospital blood bank. First is the packed red cell, that is extensively used in anemia and other surgical procedures. For different surgical procedures, we provide different type of packed cells, such as in case of neonates, the packed red cells are calculated according to the weight of the neonates, and a specific type of packed red cell is given to the patient depending upon what type of need is there. The second is random donor platelets, that in common language we tell is that platelets only. The platelets are given in case of thrombocytopenia, that is when the platelet count of the patient is below 1,50,000 or there is a need of platelet transfusion due to the lack of platelets. It is also given in immune thrombocytopenia, where the body's own antibodies are against the platelets, and also given in fetal neonatal albumin thrombocytopenia, when the mother's antibodies destroy the fetal platelets, resulting in bleeding. RDPs are also used in neurosurgery, critically ill patients, that is the ventilated patients. They are also given for chemotherapy patients who need chemotherapy on a regular basis, and also for patients who after the BMT or the PBS, peripheral blood stem cell collection procedures. The platelets given are generally not cross match, but given according to the ABO specific, means group specific platelets are given whenever there is required. The next is FFP, that is fresh frozen plasma. It is given in case of surgeries, DIC, and other procedures where the specific factors are needed to correct the factor deficiency. The fourth component that is used is cryo-precipitates, generally given for factor correction in case of hemophilia and other types of transplants and surgeries where there is extensive bleeding. In our blood bank, we also do the blood grouping and antibody screening of patients and donors. As we all know, there are 4 types of blood groups that is generally prevalent in our general population, that is A, B, O, AB, and other is the RH type. In every blood bank performs all these type of tests. But leaving apart these 4, there are 18 other major antigens, and when the patient are lacking these 18 and one of the 18 antigens are given a blood that contains this type of antigens, that he or she may develop antibody to these antigens, that may result in early type of transfusion reaction or delayed type of hemolytic transfusion reaction, resulting in increased mortality and morbidity of the patient. In AMRI blood bank, what we do is perform antibody screening on every patient, so that if the patient has these type of antigens, we prepare the blood accordingly according to the antibody present, giving the patient antigen negative blood, so that the antigen antibody reaction doesn't happen and the patient is free from any type of acute or delayed type of hemolytic reactions. To prevent the RH-SDFN, what we do is perform the maternal antibody screening when the mother comes for her regular checkup. So we do an antibody screening. We determine if antibody is present or not. If the antibody is present, we do the antibody titer level and advise the mother to come after 4 weeks, so that we can check the antibody titer level if it has increased or decreased. And if it is increased, we alert the clinician and prepare the mother for such type of deliveries where the antibody present may result in SDFN. Thank you.